I am Madhurya, Assistant Professor in the Department of Anaesthesia&OT Technology, Yenepoya School of Allied Health Sciences, Yenepoya deemed to be University. In this session, we will be discussing about supraglottic airway devices. At the end of this session, you will be able to classify supraglottic airway devices and list the indications, contraindications, advantages, disadvantages and the use of different supraglottic airway devices, and able to explain the technique of insertion of the supraglottic airway devices. And the introduction. As supraglottic airway devices, the name suggests these devices are placed above the glottis for airway management. These devices serve as a niche between face mask and endotracheal tubes. They are commonly used in current day practice, that we can say that it is an era of supraglottic airway devices. The most commonly used supraglottic airway devices are laryngeal mask airway. So this is the picture of a supraglottic airway devices where it is placed in the glottic region. Supraglottic airway devices are the medical devices used to maintain an open airway in patients during anesthesia or emergency situations where intubation is not feasible or necessary. They are positioned above the glottis, the opening of the windpipe, and provides a less invasive alternative to the endotracheal intubation. And some common features of supraglottic airway devices are positioning, rest above the vocal cords without passing into the trachea. Ease of use, can be inserted without requiring direct visualization of vocal cords, make them useful in emergency situations for non-expert users. And the purpose of supraglottic airway devices are to facilitate ventilation, oxygenation and administration of anesthetic gases. So the laryngeal mask airway is a supraglottic airway device developed by British anesthesiologist Dr. Archie Brain. So these are the parts of LMA: cuff, aperture bars, connector, airway tube, inflation line, inflation pilot balloon and the valve. So the uses of laryngeal mask airway are for airway management in fasting patients who do not suffer from significant gastroesophageal reflux. They may also be used in an emergency airway where an practitioner's skill is intubation is not available, as an emergency airway where the anesthesiologist cannot intubate or cannot ventilate situations. The indications of laryngeal mask airway are it works as an alternative to intubate where difficult intubation is anticipated, securing airway in emergency situations where intubation and mask ventilation becomes impossible, as an elective method for minor to moderate surgeries where an anesthetic electively wants to avoid intubation, as a conduct for bronchoscopies and gum elastic bougies. And the contraindications of LMA are full stomach patients, oropharyngeal abscess, morbidly obese patients, pregnancy where the chances of aspiration are high, hiatus hernia, increased airway resistance. And the advantages of LMA: easy to insert, insertion technique requires less skill than intubation, even paramedical staff can be inserted, does not require any laryngoscopy and muscle relaxants, does not require any specific positioning of cervical spine, therefore can be used in cervical surgeries. Complications of intubation can be avoided. And less sympathetic stimulation as compared to intubation. Patient awakening is smooth as compared to intubation. Reusable up to 40 times. Emergence is smooth, which is particularly useful in head and neck surgery. And the complications of LMA are air can leak into esophagus, LMA increases the risk of aspiration, can cause laryngeal spasm and airway obstruction if displaces anteriorly. and it causes trauma to the oral cavity and injury to the hypoglossal and linguinal nerve. If excess pressure are being used, cuff pressure for LMA should be kept 40 to 60 mm H2O, and the sore throat incidence is 10 to 20%. And LMAs are classified into generations. The first generation of supraglottic airway devices contains a simple airway tube, that is classic laryngeal mask, flexible laryngeal mask airway, other laryngeal mask airways, and cobra perilaryngeal airway. And the second generation of supraglottic airway devices has an additional features of provision to protect against regurgitation and aspiration, that is Procil laryngeal mask airway, iGel laryngeal tube, and laryngeal mask airway Suprint, and streamlined pharyngeal airway. This is how the second generation supraglottic airway. And the third generation of supraglottic airway devices are self-sealing mechanism, that is the Buska airway. And the technique of insertion of an LMA. Prepare the LMA by fully deflating the cuff. Apply water soluble gel to the back of the cuff. Hold the LMA like a pen with the index finger. Place anteriorly at the junction of the cuff and tube. Push the mask backward along the heart palate. Insert the index finger fully into the mouth. To complete insertion, stop with resistance is felt. Inflate the cuff and connect the breathing system. The manufacturer recommends using a bite block with LMA Classic. LMA Classic may be the most important development in the airway management in the last 25 years. LMA Classic consists of a blouse-shaped mask surrounded by an oval inflatable silicone cuff. It is usable up to 40 times and is sterilized by steam autoclaving. And the LMA Classic available in sizes 1 to 6, designed to fit most of the airways from neonates to large adults. And the size selection depends upon if the mask size is 1, it can be used for neonates up to 5 kgs. And the mask size is 1.5, it can be used for the infants 5 to 10 kgs. And the 2 size is required for 10 to 20 kgs of infants. If the mass size 2.5, it can be used for the children 20 to 30 kgs. And the last size is 6, it can be used for the large adults. And Procil LMA. The LMA Procil has 4 main components: mask, inflation line with pilot balloon, airway tube, and the drain tube. Unlike LMA Classic, there is a gastric drain tube that opens the tip. This is designed to the channel fluid away or permit the passage of an orogastric tube. It also reduces the inflammation of stomach during prolonged ventilation. Indications are obese patients, laryngoscopic surgeries with positive pressure ventilation. LMA Flexible combines the original LMA cuff designed with a narrower, longer and wire reinforced flexible airway tube. Its flexibility and extra length feature makes it particularly useful for the procedure in which the surgeons and the anesthesiologist works in the same area, such as during ENT, maxillofacial or dental procedures. The LMA Flexible is available in the sizes 2 to 6 in both reusable and disposable versions. Intubating LMA, or it's also called as fast track LMA. The intubating LMA is a intubating laryngeal airway intended to provide both ventilation and consistent ability to pass an endotracheal tube blindly into the trachea. Compared to the classic LMA, the primary distinguishing feature of fast track LMA includes an anatomical curved rigid airway tube, an integrated guiding handle, an epiglottis elevating bar can be replaced with the classic LMA vertical aperture bars, and a guiding ramp built into the floor of the mask aperture, providing a conduit for the endotracheal tube passage. Next one is LMA C-track. The LMA C-track is a new system for airway management and endotracheal intubation. It is based on the intubating LMA system with two inbuilt fiber optic channels, one to convey light from the other to convey the image of the view. The C-track has a epiglottis elevating bar which elevates the epiglottic during passage of endotracheal tube through the C-track into the larynx. A rechargeable battery is provided for up to 30 minutes of continuous use, indicated for achieving and maintaining an airway in both anticipated and unexpected difficult intubation. And the Cobra perilaryngeal airway is a cuffed, disposable, sterile and latex-free supraglottic airway device. It is made up of polyvinyl chloride. It has three parts: head, circumferential pharyngeal cuff and breathing tube. Cobra head distally broadens into the shape of the head of a cobra snake. Slotting opening of the cobra head hold both of the soft tissue and the epiglottis away and permits an air exchange through the opening. Breathing tube can be attached to the standard 15 mm inner diameter connector. iGel is a second generation of supraglottic airway device and invented by Muhammad Aslam Nasir in 2007. At body temperature, this changes its shape and conforms with the patient laryngeal anatomy. This avoids the compression trauma of the soft tissue. At body temperature, this changes its shapes and avoids the compression trauma of the soft tissue. The tube of the iGel has a drain tube and breathing tube. And the features of the iGel are soft, gel-like non-inflatable cuff, airway channel, suction channel, integrated bite block, epiglottic rest, buccal cavity stabilizer. And the iGel are available in different sizes for different age groups depending upon the weight of the patient. Size of the iGel is 1 and described from the neonates. Weight is 2 to 5 kgs, and iGel 1.5 infants weight is 5 to 12 kgs, and iGel size is 2, small pediatrics 10 to 25 kgs. 2.5 iGel can be used for the large pediatrics weighing 25 to 35 kgs. And the iGel size 3 can be used for small adults weighing from 30 to 60 kgs, and iGel size 4 can be used as a medium adult weighing for 60 to 90 kgs, and the iGel size 5 used for the large adults weighing above 90 kgs. LMA Supreme. It is a single use device similarly but not identical to the LMA Prosil. Unlike LMA Prosil, it is a pre-curved to facilitate insertion, and it has a gastric tube integrated with the airway tube. Supreme LMA is like a Prosil LMA with a bite block to avoid damage to the LMA tube if the patient bites. So this is how the LMA Supreme looks with a feature called curvature. Buska mask airway. Buska mask is a newer supraglottic airway device similar to the LMA. It has a non-inflatable cuff that is continuous with the airway channel and thus gets inflated with positive pressure ventilation, reducing the chance of gastric insufflation and aspiration. Positive pressure ventilation improves the cuff seal. It comes with an elbow connector for suctioning. Buska mask airway. And the parts of Buska airway mask are cuff orifice, tab, bite block and ventilation tube, suction angle piece, draining channels. And the summary of this session is: supraglottic airway devices are non-invasive tools that maintains an open airway by resting above the vocal cords. They are alternatives to the endotracheal tube in both elective and emergency situations. The choice of device depends upon the patient condition and the procedure and the level of airway protection needed. While supraglottic airway devices offer simplicity and effectiveness, understanding their indications, limitations, contraindications, ensuring the optimal use and patient safety. These are the references. Thank you.